Why is quality important to you, and how did you begin working in this area?
First, I should say I was a primary care doc working in rural, remote northern Ontario, and seeing lots of patients in the hospital, in my clinic, and really, losing a lot of sleep over how to give better care in a really resource-constrained setting for Canada. That was a pretty difficult setting. And it was a tough job, and I think we struggled on how to do that. And I think we did the best we could in those circumstances, which are still so much better than what most of the world faces, of course, today. So I've been thinking about quality as a professional for a long time, and then I think I came to global health and public health. And trying to understand people and patients and what are we seeing from the population surveys, for example. It struck me at the very beginning of my research career that people are using some services but not others. And so I started asking, why? Why is this? Why are you skipping facilities? Why are you bypassing? Why are you using this facility for antenatal care, but you would never come back for delivery? What's going on with that?
Yeah.
And that's actually when the first signs of the importance of quality emerged from our research. And the more work I did with my colleagues in Africa, the more people we asked, the more experiments we performed, and the more I read, the more I realized that quality is fundamental to people in every part of the world and for every health condition. Yes, they define it a bit differently. People who have a sick child maybe are immediately focused on the competence of the provider, whereas women for delivery are more focused on the interpersonal care. But they all want to get better. They all want strong skills and respect. So it's that body of evidence and work that really shifted my thinking to asking the question, what's actually going on in facilities then? Yeah. People demand it. Their actions are based on quality. What's actually happening in the health system? And so for the last several years, our team have been looking at just that question. And that's also led to this work on the Lancet Global Health Commission to try to interrogate the point of intersection between systems and users, because that's where health care happens, and that's where health is built, at least in terms of the health system's contribution to population health. That's where all the work is done. So understanding what people's expectations are and understanding what it is they actually get has been a huge preoccupation for me. I think if we don't attend to that, then the health system I think we forego a massive opportunity to improve population health, because the health system should take its place as one of the determinants of health.
Yes.